Hello everyone, my name is Bijan Shafibeg, and today we'll be looking at the treatment of schizophrenia. Neurotransmitter theory behind schizophrenia. There is no current cause or causes of schizophrenia. It is categorized as a polygenetic disorder. Genetics play a valuable role in this disease since it is passed through generations. When it comes to studying this disease, the most studies in dopamine and glutamate. Amphetamine is positive for a patient with schizophrenia because it produces positive symptoms for these patients. Drugs such as phencyclidine and ketamine amplifies positive outcomes or symptoms for suffering from schizophrenia. Stimulants release dopamine, phencyclidine, and ketamine to antagonize NMDA receptors. Thus, the combination of these neurotransmitters are directly involved in the pathophysiology of schizophrenia. According to WHO, schizophrenia is a chronic mental illness that affects 20 million people worldwide. A polygenetic disorder means that many different causes can be attributed to this. Continued. Another theory, neurotransmitter theory, is that since high levels of serotonin and dopamine levels have outcomes or symptoms of schizophrenia, that low levels of neurotransmitters lead to bad symptoms of schizophrenia, which leads to bad schizophrenic episodes. Risks and benefits of treatment. The risks. Cholinergic blockade produce, dry mouth, dilated pupils, blurred vision, cognitive impairment, constipations, urinary tract retention, and tachycardia. Histaminergic blockade produce sedation and antisemitic effects. Serotonin blockade produces sedation and weight gain. Noradrenergic blockade, hypotension and sedation. Although these can cause the brainstem to have antipsychotic suppression, behavioral arousal, increased reticular activation center, vomiting by the dopamine receptors in the chemometric trigger zone. The benefits of this treatment. Even though there are side effects of drug treatments, it is outweighed by the positive ones of the drug treatment. It gives the patient their lives back. Medication reduces negative symptoms of schizophrenia. Increases positive symptoms of schizophrenia. Reduces and can even halt schizophrenia episodes for a length of time. Most of the risk symptoms can be helped with other forms of medication such as eye drops, glasses, medication, alternate medication, healthy lifestyles, and exercise, which also produces dopamine and serotonin. The rates of success with drugs. There is no cure for schizophrenia, but with drug treatments there is a 60% success rate. Patients can stay in remission with proper treatment plans. They are also able to lead normal lives. Even with all this medical treatment, a patient with the disease life expectancy is still reduced by 10 to 25 years. Now, if a patient can have a diminishing of recovery by unhealthy lifestyle, not taking prescribed medications, or following the treatment plan, also not exercising, smoking, drinking alcohol, followed by suicide. There are multiple side effects of these drugs, such as tremors, dizziness, increased salivation, increased prolactin hormone levels, secretion of milk from breasts, excessive sleepiness, weight gain, alteration in sexual functions, and development of diabetes. When treating schizophrenia, is medication necessary? Schizophrenia is a lifelong chronic disease, requires a lifelong treatment plan. Once a patient has a good treatment plan that is sustainable, it is between the patient and the medical team on whether to reduce some medication or to wean off. However, since this is chronic disease, it will require treatment throughout life. According to a study by Patel, since patients rarely return to their baseline level of adaptive functioning, both non-pharmacological and pharmacological treatments must be used to optimize long-term outcomes. To answer the question of is medication necessary for treatment of schizophrenia? Well, simply the answer is yes, it is. By not seeking medical attention and medication, this mental illness can be extremely dangerous for the individual and others around them. And here are my references. Thank you very much.